It's bad enough to end up in the hospital. It's worse when the bill almost gives you a heart attack. How do you know if, say, a trip to the emergency room will cost you a reasonable price? It depends on a lot. The Wall Street Journal looked at one example of how prices can vary in Boston. It used new public data to compare two hospitals that are a few miles apart. The Journal found a $400 price difference just for the visit itself. That's on top of procedures like imaging scans, which adds the price. What's behind these differences? And how might a better system work? In a moment, you'll meet a doctor with an idea for how to improve things. But let's begin with Melanie Evans. She's one of the Wall Street Journal reporters who worked on this story. Ms. Evans, welcome. Glad to have you with us.
Thanks for having me.
So you were focused on two hospitals in Boston. The report includes other hospital systems as well. But the price disparities for ER, the gaps are just kind of all over the place, all over the country. Why does this gap exist? Why is it that if I go to the hospital on 40th Street and the hospital on 50th Street, it can cost so vastly different amounts of money?
Okay, this is the question that everybody's asking. And for the first time this year, we can see very, very clearly how, as you said, all over the map those prices are. And this look at one city let us really unpack it. So we were able to look at price differences between hospitals, and then we were able to look at price differences within a hospital. So the question of what drives those differences can come down to a couple things. It might be that one hospital has higher underlying costs than another. And it might, because they offer sort of more comprehensive, specialized services, it might be that one hospital has better quality than another. And so they maybe are spending more money to get a better result. And when we talk to healthcare economists, they say, well, yes, across hospitals, that might be part of the reason, but it doesn't explain everything. And within hospitals, that really doesn't explain why the prices are so different.
Yeah, and I also wanted to get deeper into one aspect of the story, which uses a hypothetical patient, but real people are drowning in debt because of these costs. You profiled a woman in October named Barbara Kingsbury, who unfortunately perished from cancer. Now her widow, her husband, is left with a medical bill of $100,000, and that's with insurance. How does this happen? How actually are hospitals getting away with this?
So this is kind of an illustration of the fact that insurance is not a guarantee of a competitive price. And it comes down to this sort of question you started out with. Why are the prices so different? And what we found when we looked at Barbara Kingsbury's bills is that she paid prices that were higher than other people did. And in fact, she paid two different prices for the same scan at the same hospital. So it's the same patient, same hospital, same imaging equipment. She got two different prices for it. One of them was $8,000, one of them was $2,000. And really what it comes down to is if you strip away reasons like quality or underlying costs, what you're left with is leverage at the bargaining table. So hospitals and insurance companies bargain. And sometimes one has more power than the other.
Yeah, forgive me for interrupting you. I know our time is very, very short.
Yes.
I hate to be overly, trite and concise about this, but before I have to let you go, it sounds like part of what you're saying is that hospitals are doing this because they can, because in a number of ways they just are able to get away with this, and that's sort of the way that it's been. Is that too cynical a way to view it, or is there a little bit of truth to that, briefly, before we go?
Okay, so yes, hospitals will price what the market can bear, and they can do it at the bargaining table with insurers, and insurers sometimes have the market power to push back, and sometimes they don't.
Melanie Evans of the Wall Street Journal, I appreciate you helping us start this conversation. It is a fascinating report in the Journal. Thank you very, very much. We appreciate it.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.